Hey guys, this is Venkat for venkatfin.com. I hope you and your family members are in good spirits. Um, if you need a genuine consulting when you're taking health insurance or in the purchase process of term insurance, you can always message me or call me in this number 9384716268. I have a very strict no spam policy, which means I won't be forcing you to take health insurance or term insurance through me, but I will just guide you what is the right product, and it is up to you. So if you have any idea of getting health insurance through me, message me or call me. I'll be happy to guide you. If you have any doubts in related to health insurance or term insurance also during the purchase process, you can call me. I charge a very small consulting fee. So call me and ask how much is the consulting fee, and you can proceed. You can always message me anytime. So in this video, we are going to see two riders offered by Niva Bupa Reassure. So Niva Bupa is the health insurance company. Reassure is the product. On top of that, there is a rider called Safeguard Benefit, Hospital Cash Benefit. Now Niva Bupa has introduced a new rider called Acute Care Plan, and another one Disease Management Rider. So these riders will be helpful, especially for someone who has diabetes and BP, that is disease management, and another kind of audience who might choose this rider is those who are looking for unlimited teleconsultation and also coverage for pharmacy and diagnostics tests. So let us go on with the product. If you are interested, you can like or subscribe with this channel. Do not see the video and purchase online or take your own decision, because whatever I say, your financial product will always have its own risk. So be very careful. So this comes under their brand new strategy, product line called, rider line called Future Smart. So about Niva Bupa, the company is really growing good. By 2023-24, they are planning to cross 5,000 crores gross return premium, which is going to be a great milestone for the company, because many people don't know much about Niva Bupa. That's why I want to tell this message. Okay, now we will see the two riders offered today. So acute care rider and disease management rider. To simplify things, acute care rider offers OPD benefits, including pharmacy and diagnostic test coverage. Okay, what OPD? Not that you're going to meet the doctor close by and then you're going to get covered. No, what they actually mean is OPD is teleconsultation with network of 60 to 70 plus Apollo hospital doctors across India. So which means the OPD is for the teleconsultation. Based on the teleconsultation, the Apollo doctors may suggest you some medicines, right? And they may ask you to go through some tests. That also is covered. And there is a limitation in how much coverage is offered in that. So that is acute care. Now let us come to the next one, which is something I really like. Disease management. Usually in any health insurance product, you will have to wait 3 years if you have diabetes and BP for any hospital admission, which happens due to that particular health issues. Now, because of disease management rider, if you're going to choose that, buy Niva Bupa Reassure, on top of that buy DM, which is the disease management rider, from day one, which is the first 30 days after that, you can get coverage for diabetes and BP instead of 3 years waiting period. So what is acute care? Once again, I will explain in detail. They offer you unlimited teleconsultation with doctors from working in Apollo hospitals across India. Under acute care, they have two differentiation. One is best consult, another is best care. So in disease management also, I told you day one coverage for diabetes and BP patients instead of waiting for 3 years. Under that also, there are two variants. One is gold and platinum. Now let us come to Apollo, the acute care plan, which is like they have tied up with Apollo hospitals. So 24/7, anytime you can reach out in a particular number, 1-800-309-0911, and take the teleconsultation from the expert hospitals, expert doctors. They could be a cardiologist or a general physician or a urologist or anyone, or pediatrician. So based on the requirement, you can call them and ask for advice. During that time, what kind of OPD and pharmacy and diagnosis is covered. During the teleconsultation, the Apollo doctors will be suggesting some medication, right? That medication is covered under prescribed pharmacy coverage and prescribed diagnostic coverage. So only if they are going to prescribe that is being covered. Got it? So if you are going to buy the medicines and do diagnostic tests from the network hospitals, Apollo network hospitals, it is cashless. Otherwise, you have to do reimbursement. The rider is just launched, and that is the reason I have shown conditions apply. So be very careful and clear. So let us see the sample premium at a glance. For example, you are going to take Niva Reassure Health Insurance and on top of that acute care. Okay. So I told you there are two variants. One is Best Consult will offer you only unlimited teleconsultation with the Apollo doctors, and Best Care is the one which offers you either 5,000, 10,000 or 15,000 or 20,000, both in pharmacy and diagnostics text coverage. Got it? Mostly you can choose 5,000 or 10,000 if you are young family. If it is an elderly person, they can choose for 15,000 or 20,000. Based on that, the premium will change. Got it? Now let us see the sample expenses. For example, for a family of husband, wife, and two children, they are a young family, 35 years old, two adults and two children. The base premium will be today, not tomorrow. Today, the base premium today is 18,200 rupees approximately. So they have chosen acute care plan. In that best care plan, the limitation of 5,000 rupees both for pharmacy and diagnostic test coverage. So each one, husband, wife, and two children will get in a policy year up to 5,000 rupees for both pharmacy and diagnostic test limit, in case if it is being prescribed by the Apollo hospital doctors during the teleconsultation. So how much is the premium charge for this? You'll basically get a 40,000 rupees benefit here, and the premium for that is only 12,000 rupees. That's what they are saying. So adding the base premium with 18,200 rupees plus this 12,000 rupees, approximately more than 30,000 rupees is going to be the premium for this rider. So they are also saying the Best Consult premium is the same for all age groups. I want to clarify that. Now let us come to the next product rider called Disease Management Rider. This is the one I might be using regularly, because many of my prospects, they say that I have sugar, I have diabetes, I have BP, high BP, low BP, whatever it is. So I will ask them, I will tell them it is a huge process. You have to pay the premium. Then the underwriter will see your test reports and they will say you might have to pay a loading fee, and then they have to approve. Now there is no loading fee if you are going to go for this rider called Disease Management Rider, and you don't have to wait 3 years. Day one, which is the first 30 days alone, you have to wait. Then you will be getting coverage for all the issues. Got it? Now in Disease Management Rider, there is an option wherein you can do quarterly health test. In quarterly health test, if you are keeping your diabetes and BP under control, in the end of the year, when you are renewing the premium, renewing the policy, they are going to get 20% discount on overall policy premium amount. Got it? Now let us see the sample here. For example, you have chosen, I told you there is gold and platinum variant in Disease Management Rider. So in that, gold offers day one coverage for diabetes and BP. They also offer discount for 20% for renewals. So platinum also offers that. So what is extra in platinum? In the whole policy year, you will get extra 3,000 rupees coverage for the quarterly test that you are doing, right? That coverage is also being given for the whole year. You will be getting that extra 3,000 rupees for doing those tests, BP and sugar test. Got it? So that is it, right? So here again, I will show you the sample premium given by Niva Bupa company itself. For example, it's a husband and wife who are 45 years old, approximately, two adults. Their base premium for Niva Bupa Reassure product will be 14,000, or lastly be 800, approximately let's say 15,000. Usually there will be a loading fee, right? 2,000 rupees. So if you are going to add that along with the Disease Management Platinum plan rider, 4,600 rupees, along with the Best Consult Unlimited rider for 2,140 rupees, totally you will be getting around 23,700 rupees. That will be the premium. But here they are saying there is no loading fee at all for diabetes and for diabetes alone. So you don't have to worry about it. Just pay the base premium, just pay the Disease Management Platinum plan premium, and the Best Consult premium, that is 21,600 rupees for you when you are opting for disease management. And within, as soon as you bought the product, you are going to get coverage. Day one coverage for diabetes and BP, hypertension. No waiting period for pre-existing diseases. Only these two pre-existing diseases, not other diseases. Be very clear about it. No extra loading fee. 20% renewal off on the renewal of the premium if you are going to maintain good health. The report should say it is under control. diagnosis text per year 3,000 rupees coverage if you're going for platinum. So I hope I've clarified you these two plans, which is like a Smart Health Acute Care and Smart Health Disease Management rider. It offers you 360 degrees coverage, including coverage, best coverage. See where you can pitch these, to whom I should pitch these. I don't, tell all these riders to everyone. Let's say you are a working professional working in Bangalore, Mumbai, in a metro city, and you don't have a concept of family doctor. You don't know anyone who's a family doctor. At that time, you might have used this best consult, wherein you can call anyone at any point of time. You have a small child, you can make use of it. So that is it, guys. For elderly parents, also this will be certainly useful. And by the time I'm finishing this, my mother is running her mixie in the kitchen. So so this is the number 938462. I mean 9384716268. I charge a very small consulting fee. That is to ensure that people just randomly see the number and no matter what doubts they have, they call me. You can call me, but pay me a small consulting fee is my question, because sometimes people will call me and they'll be desperate to get that discount online. But remember, only if you get through a health insurance advisor, you can get two kind of support, which is like I will also clarify the doubts you have any point of time, and customer support in the health insurance company also will be there to give you clarification at any point of time in your as a customer journey. So you will be doubly satisfied. That is advantage in taking health insurance to a health insurance advisor. I hope you understood this product and riders. I will give links to Nivabupari Assure product also in this description. So message me or call me any time of the day at 9384716268. Thank you so much. This is Venkat for venkatfin.com. Thank you so much.